Hey folks, my name is Dr. Mansouri, and I'm going to do a demonstration of several different impression techniques. One of the first things we're going to go over as dental assistants, sometimes when you're working for your general doctor or orthodontist, you have to take impressions for orthodontic appliance, or maybe for Invisalign aligners, those clear aligners that sometimes many offices provide. Doesn't matter if it's Invisalign or Clear Choice or other companies, but the impression that you have to take has to be very accurate. It has to be right on in order to be able to show all the grooves, all the imperfection spots on the teeth, so the actual trays can fit perfectly like a glove. Now I'm going to show you guys one technique, one skill that we use to take the impressions that helps with patients that have maybe gag reflex or difficult to take impressions with, and almost every time you get a perfect impression. Now, let's talk about impressions for clear trays. Clear trays that some of you may have already seen. There are these little plastic trays that the laboratory fabricates. There are a series of trays that helps the teeth move to a better position. They fit on your teeth like a glove. So if the impression is not accurate, if you have a lot of bubbles or a lot of areas that are kind of distorted, this tray is not going to fit, so it's not going to do its work. Of course, you can do a scan of the teeth, which is very common. But if you're not doing a scan, impression is the next choice. Now, in order to do the impression for those, we're going to review the skills. First, you want to try the tray. Make sure the tray properly fits in the patient's mouth. I'm going to try this tray, make sure this is a proper tray. Okay. Very good. Yeah. So the tray has to passively fit. The tray has to passively fit without any interference. I tried the tray, everything looks good. In this case, I don't need any other adjustments to the tray. Sometimes the trays have to be bent a little bit open if the teeth are a little bit arched out, or the trays have to be modified maybe with a little bit of a wax to make it fit better. But in this case, this stock tray works fine. However, in order to be able to get a perfect impression, we're going to create a custom tray. The way we do a custom tray is we fill the tray with a heavy body impression material or medium body impression material. We will put a plastic bag over it. So this plastic bag is going to prevent the material from sticking to the teeth. But at the same time, we want to loosely hold this plastic bag. So when we would press on it, it will mold around the teeth to create a custom tray. You got to wait a couple minutes for the material to set. And the plastic bag would prevent the material from flowing back in the back of the throat of your mouth. So a lot of times patients are gagging. You're not going to have any excessive material because this bag will collect all that stuff, and then we'll put it in the patient's mouth. So what we're going to do, we're going to use a heavy body impression materials. Remember, you're always going to squeeze a little bit of it out to make sure you keep track of your working time. I'm going to fill this tray out with the material. This material is a heavy body fast set, so it's going to set really fast and quickly. When I'm filling the trays, make sure the trays have little indentations, little grooves. You want to lock in the material inside, so you can you want to be able to visualize the excess material coming out. Usually when you're taking an impression, you don't want to have the tip of the impression material in and out. It creates bubbles. In this scenario, it doesn't really matter because we're doing a bag technique. So I filled the tray. It's not 100% full, but it's full enough. I'm going to put this bag over it. I'm going to hold the bag loosely on it, and I'm going to go in the patient's mouth. Once it's in the patient's mouth, you want to put the back area first. You want to visualize to make sure all the excess material has come down covering the teeth. When they've came down covering the teeth, you put a little bit of pressure on it. You don't have to worry about excessive material going up and down. And I'm going to maneuver the cheek over the plastic bag to kind of get a little bit of a borders. You can see how I move this cheek a little bit front and back. And essentially at this point, we're just going to wait. You're going to wait for the material to set. Because of the plastic bag inside the tray, the material is actually not going to stick to the teeth, but it'll be closely adapted around the teeth. So this will create what's called a custom tray. Following the custom tray, I'll show you guys the technique we use to fill that in with light body impression material, and that will capture every little groove of the actual tooth. So with this plastic thing, it prevents material from going back. It helps prevent from sticking. Now the things you cannot use this technique on if someone's got a loose tooth or someone's got a loose crown. I mean, this is certainly going to pull it out. It's really tight. If someone has a lot of spaces between their teeth or undercuts or a bridge, this can go underneath and it can be a little challenging to get out. All right, now that the time's up, we're gonna gently remove this. And as you guys can see, we have an imprint of some of the teeth in here. So I'll be able to take this out. And now I have a custom tray, meaning everything kind of fits perfectly. There's a lot of emptiness that we're going to fill in with light body and pressure material. So the next technique is, now that I have this custom tray, I'm going to fill it in with light body and pressure material, which is a lot more runnier. Typically, if you do that right away, it may run all over the place. You may not be able to get a good mold. But the key is, once it's in the patient's mouth and once inserted, I'll keep my finger on the roof of the mouth to make sure it is securely in place. Then I'll use my thumb and the side of my palm, and I will kind of move patient's cheek up and down. I'll move the patient's frenum, upper labial frenum, and side to be able to capture as many soft tissue movements as possible. This will be also a good way to take impressions for dentures and partials. Don't worry if there's little bubbles inside of that area. That's not a big deal. It's going to get filled in with light body and pressure material. So let's do the next step. You don't need this little tiny tip. You're just going to use your typical yellow insert. So now I'm going to start mixing this next part. I'm going to squeeze some out, make sure it's mixing properly. We're going to fill in inside of the tray. You don't have to put too much. So remember, the bulk of the tray has already been filled, but you do have to cover the roof of the mouth. And some of the excess will squeeze out around the patient's mouth, so that's all right. Now, I filled this out. Notice how I didn't go all the way in the back, that because the overflow is going to cover that area anyways. It's got all the inside inserted. Now I'm going to go place it in the patient's mouth. We're going to have a 2-minute timer. Once it's in the patient's mouth, you're going to keep your finger pressure firm. You're going to go around, move patients. I'll change my finger and now I'll come on this side. And if a patient is a patient that normally gags, feel free as soon as you do that, or even guide the patient, put their head forward, and sometimes they can even put their back forward to prevent any of that material going back their soft palate that causes them to gag. Now you're just going to hold it for firmly 2 minutes. The key is once you place it in, you don't want to take it off and then it creates bubbles. It's got to be one motion. You place it in and keep it in place. Okay, now that they're 2 minutes up, sometimes it has a nice suction. You can't get it out easily. So you ask the patient to close down. You use the finger, you go at the back of the area and you break that seal. And then you remove the impression. With this technique, you'll be able to capture all of the little tiny areas, all the grooves, all the margins, all the borders. You want to capture that retromolar pad areas or the tuberosity areas in the back. You've got the frenum, the labial frenum, you've got the buccal folds. And you examine your impression to make sure there's no bubbles, there's no air gaps, and that will be a final great impression. This can be sent to a laboratory because it's made from the VPS material. It will not be distorted. They'll be able to make models and series of trays based on this. This type of impression material can be reused as long as you don't distort it or cut it. And that's the back technique impressions for the upper. Okay, so for the bottom, you do the same technique we just talked about. Heavy body, plastic bag, place in the patient's mouth, firm pressure, squeeze all the excess out, make sure it covers all the teeth, and then wait 2 minutes. After 2 minutes, the material will kind of create a custom tray. Then you're going to do light body impression materials, place it on the patient's teeth, firm pressure, keep your 2 fingers on, and then what you're going to do, you're going to ask the patient to do 2 exercises. One, you're going to ask them to stick their tongue out and try to lick their upper lip, or and to use their tongue to touch the inside of the cheek, left and right side of cheek. That will create the movement of the tongue, and it pushes all the excess material out of the way. So if they are having a partial or a denture or any orthodontic appliance, it will not be interfering while they're eating, which the tongue's going to be moving around. Now we're going to come back and do this technique with the alginate impression. Now, the previous technique we talked about was with VPS, vinyl polysiloxane material. It's a very good material. It doesn't get distorted. It's great for clear aligners or any orthodontic appliances. But we can use alginate. Alginate is not as accurate, meaning you cannot have it in a laboratory sitting on the shelf for 30 days without distortion. But if we're doing an impression for partial or dentures or any other removable appliance, alginate will be great. Now, some other times you may want to have you use alginate if a patient has some loose teeth, some teeth that are periodontally involved, going to be extracted maybe soon in the future, or they have a lot of spaces between their teeth that this type of impression material can go lock in. You want to use alginate, because if you don't use alginate, the patient tooth can come out with this material. It's so tight and firmly around the teeth that kind of can cause that temporary crown or loose tooth to come out. So we're going to do alginate. We're going to mix the alginate like you normally mix, however technique you use. But again, we're going to review the procedure with a patient. We're going to ask the patient to stick their tongue out, move it left and right, try to lick their upper lip, and touch inside of the left and right side of the cheek. In order to be able to do a good impression for partial denture, it's not as important that you have to get all the grooves on the teeth, but you also have to get all the soft tissue around it. So when they're wearing the final partial or denture, when they're chewing, when they're moving around, you're not causing any sore spots. So we're going to review that technique. Let's grab 2 scoops of alginate. One, 2. I'm going to put just a little bit more. Okay, so we got 2 scoops of alginate. We're going to use cold water so it can give us a little bit of a room for mixing. I'm going to put the water in here. We're going to mix it up. I want it a little bit more runnier, so I'm going to add a little bit more water. Just a tiny bit more. Now, the alginate, you want to make sure you squeeze it against the bowl so you don't have any powder. You want to have a nice consistency of it so there's no bubbles. You want to pick up all that stuff in one scoop. You go inside your trays. You're going to put it on your tray. And there you go. Now we're going to go in the patient's mouth. Now, in order for me to get a perfect alginate, I'm going to just put a little bit of water on the top, so it's a little bit more runny on the top part. And I'm going to go in the patient's mouth. Once in the patient's mouth, you're going to place this on the patient's teeth. I'm going to keep 2-finger firm pressure on it. You're gonna move the cheek. Now, ask the patient to stick their tongue out, move it left and right. As they do that, you see the material moves. Touch inside of your cheek, left and right. One more time, if you can stick your tongue out, move it left and right, trying to lick your upper lip. That's good. Now, you can ask the patient to relax their tongue. The material is already changing color, so that's good. The white color means it's starting to set. Remember, I just used my finger, made my finger a little bit wet, and I kind of just touched the surface of the alginate. That made the top surface a little bit more runnier, so that way when I press on the patient's tooth, I can get a nice impression of the grooves of the patient's teeth. Keep it in place for about 1.5 minutes or whatever the instructions of the alginate is. I typically keep it just a tiny bit longer to make sure everything's completely set, and then we'll go take a look. But it's very important to make sure you do those exercises with the patient. Often explain the procedure to the patient before you start, so if the patient has any questions, they can ask you. You can't do that while the patient's mouth is full, and then they don't understand your instructions, and your impression will not be as ideal. It's a little messy, but after everything sets, it's easier. You can give a patient a wet towel, or you can clean that area with a little bit of wet towel. So now the material is kind of a little bit set. Once again, you ask the patient to close down a little tiny bit. And then you're able to remove the impression. So on this impression, again, you can see we were able to capture all the buccal fold, the buccal frenum, the labial frenum, the lingual movement of the tongue, and in addition to that, you got all the dentition, all the margins, all the boulders. Not much of a bubble, little small bubble here, but that will be okay. And that's your final impression for the bottom. You can use this for dentures, partials, any removable appliance. Of course, our patient had full dentition, so this was just a sample. If the patient was missing a lot of teeth, sometimes you have to put wax around the border of the tray to mold it to the patient's soft tissue. Now, next thing I want to talk about is very important. We have to make sure the patient tray fits properly in order to be able to do a good impression for dentures or partials. What do I mean by that? When a patient comes in for denture, obviously they might be already missing many teeth, or maybe they're having several teeth that are loose or out of position that they're going to be extracting soon, so they want to have an immediate denture made. For both of those scenarios, we have to take an impression. Now, the custom trays that we have typically are designed for patients with full dentition, or at least majority of their dentition. If someone's missing many teeth or has some loose teeth, we have to modify the tray to create a custom tray. The way I normally do that, I'll try to put tray on to see which areas this border of the impression tray does not meet or does not come close to the buccal folds, meaning the bottom area of the tissue. Then I will use this kind of a rope wax. It's flexible. I'll start from the corner. I squeeze it onto the edge. I lock it in, and then I'll kind of mold it around. Often I do it all around, but if it looks like I don't need it in the front, I may skip it and just do it in the back. Or sometimes I do in the back double fold. What do I mean by that? I use my 2 fingers, I'll squeeze it, and I'll kind of press it on the edge so it stays in place. So you see that that's kind of, I press it on the edge, and then sometimes you have to do it in the inside areas as well. The purpose of this is so the tray can carry the impression material all the way to the depth of the soft tissue, which is because of the extracted teeth or removed teeth, they may have some bone loss, and those areas might be dropped down a lot more. So I do this often to be able to capture a good size. Keep in mind, when you're doing this, you need more impression materials in the tray. So if you're doing an alginate impression, make sure if you normally do 2 scoops, make sure you do 3 scoops. It's okay if you have an excess, but it's not okay if you have too little. Now, this will be a kind of border molded custom tray. Sometimes, if you cannot mold and get this to be a good fit, you may have to take an impression to just make a custom tray. So that's also a possibility that your doctor may decide to do. But this is how you create a custom tray with the wax. Now, another thing I want to talk about, every time you do a denture, partials, you want to be able to capture the upper, low, and lower relationship. If the patient has any teeth in their mouth, let's say they got 6 or 7 on the front, 6 or 7 on the top, you want to be able to capture their bite. You use the bite registration material, you put it on the front, and you put it on the back areas. It's okay if they don't have teeth, but you have to put more material to be able to capture the gum relationship, how they touch, and extend it to the areas that they have teeth. If the bite registration material, if they have a lot of teeth missing, only maybe 3 teeth on top and 3 teeth on the bottom, then your doctor may choose to use an occlusal wax rim to be able to capture the bite. But again, I'm going to show you how the bite registration works. You're going to bring this bite registration material to the patient's mouth. So once you have the bite registration, before you take the bite registration, you want to have the patient close down, visualize where those teeth touch, because after you put the impression materials for the bite, you want to make sure they touch still the same way. Some people have a tendency when they have stuff in their mouth, they bite differently. They bite on the front 2 teeth, on the edges of the teeth. So you want to guide them not to do that. You want to tell them to bite down as you normally do. If someone doesn't have a lot of teeth and they constantly bite different way, one way to guide them to bite the correct way is to ask them to put their tongue on the roof of their mouth. On the roof of their mouth, but again, on the back posterior part of the roof of their mouth. So not on the front where they pronounce S word. They're going to put it in the back, as far back as they can. So ask them to put their tongue on the roof of their mouth and then close down. If you have them do it that way, consistently, they're going to bite down the correct way. And that's what you want. You want a consistent bite. So when they're making dentures or partials, they can calculate the patient's consistent bite, and that's the normal bite would be. I'm going to put some of this impression material now on this patient, on the chewing surface of the teeth. It's easy when a patient has all their dentition. You're just going to put one line across, and you're going to tell them to bite down. Bite down, please, all the way, and stay closed. It takes about 30 seconds. Some manufacturers, maybe a minute, for that material to set. That gives them a bite, the relationship between upper and lower teeth. But it's not always as simple as you're doing for a crown or someone that has a full dentition. You have to be able to guide the patient to that consistent, regular bite by asking them to put their tongue on the roof of their mouth and then having them bite down. So visualize that bite before you actually put the bite material in the patient's mouth. You're going to check it, make sure it's correct. Now this material is set super fast. Open, please. And that's the patient's bite. Very good. Now, sometimes if a patient comes in with an existing partial, or sometimes maybe a denture, that part of it's broken, maybe a tooth's broken, maybe a clasp, or maybe part of the partial, and maybe your doctor wants to, sees it necessary to have a repair done. A repair has to be done sometimes with a partial placed in the patient's mouth, so the teeth and the partial is securely in place. And then you have to do a pickup impression. What a pickup impression means, you're going to try the tray, make sure the tray is a proper fit. You're going to use light body, heavy body, or maybe alginate impression material to take an impression of that partial in the patient's mouth. And often when you take that impression off, the partial comes out inside of the impression. That's called pickup impression. So the laboratory can see the relationship of the partial in relation to the patient's natural teeth. Now keep in mind, in order to be able to show that relationship, the partial has to be securely in place. So if the partial is one that moves around or it's not securely in place, ask your doctor to see if they can help to secure the partial in place before you take a pickup impression. So that's really important key. Sometimes a patient comes in with a denture that is broken completely in half. If the denture can be put together by hand and perfectly fit, often what the doctor do, they will use a sticky wax, which is kind of like glue wax. They'll put the denture together so it stays in place. They will try it in the patient's mouth. If everything fits fine, then they will use that patient's denture as a tray and then put light body impression material on it and take an impression so the lab can see how that denture fits, and if there's any areas that needs repair, they can do that. And sometimes, surprisingly, if the denture fits so well that the laboratory can do it in the lab setting, they may not even need an impression. So the doctor will decide if they need a pickup impression or not for that repair procedure. So that will cover of the impressions. I want to talk about night guard and night guard delivery. I know everyone knows how to make a night guard. We have different types of night guard. We have the soft night guard and hard night guard. The hard night guard, especially when you deliver it as an expanded function dental assistant, you need to be able to pay attention to the occlusal scheme. Meaning when a patient bites down, you have to use an articulating paper, evaluate to see where the biting pressures are. Often, I've noticed when an impression is made and a hard night guard is made, the patient, when they bite down, the last teeth touch first and the rest of them don't touch. That's not acceptable. Those patients that go home without adjustment, they're going to have more complicated TMJ issues, and they'll come back, they say this doesn't fit. Your job as dental assistants are to study that occlusal scheme to make sure at least 3 teeth on each side are evenly touching. So you have to pay attention on the occlusal guard and the marks that it makes. If the marks are really heavy on the back and not much heavy on the 2 teeth in front of the back, you will adjust those heavy marks just like you do when you do a crown occlusal adjustments, to the point that you can notice 3 of the teeth on each side are touching about the same consistency, pressure on that biting stick. When they do that, then the night guard's fitted and delivered properly. Otherwise, the patient's going to have discomfort, they're going to come back, and they're going to need adjustments. So that was the important key.